All right, folks, we can get started. I know we've got a couple more people joining, but we can go ahead. Rachel, do you mind going to the next slide? Hi, all, welcome. I'm Julia Nestor, policy analyst. I use she, her pronouns. This is our agenda. We will first go over the a background, and then we'll have our Actuary Weekly and Ksenia do a deep dive into the methodology, and then we will have time for public comments. Next slide, please. So the comment period for the draft 2024 Cascade Care Savings Methodology is now up and running through August 18th. If you would like to provide comments today, we ask that you hold your questions until the end of the overview or put your questions in chat and we will get to them. And I will ask you to introduce yourself with your name and your affiliation. If you would like to wait and provide any written comments, please do so by August 18th at 5 p.m. Send your comments to the Cascade Care email on this screen and include public comment in the subject line. We are really eager to hear from you because your comments on this draft methodology will inform the final methodology applied to develop the 2 fixed dollar maximum per enrollee Cascade Care savings amounts once plan year 2024 rates are final and certified by the Exchange Board. Next slide. All right, for a bit of a background, many Washingtonians don't get the health coverage or care they need because it's too expensive. The state's Cascade Care efforts aim to make health coverage accessible and affordable for every Washington Health Plan Finder customer. Cascade Care Savings is one tool that the Washington Health Benefits Exchange can use to achieve this aim. Next slide. With Cascade Care, the exchange offers Cascade Care plans and Cascade Care savings. Unlike non-standard plans or non-Cascade Care plans, which are designed by the carrier and can vary in deductibles and copays, Cascade Care plans are designed to have the same benefits regardless of the insurance company, cover more before the deductible, and are only available on Washington Health Plan Finder. Some Cascade Care plans are called Cascade Select plans. These are the state's public option plans and provide higher quality and more savings to the customer. Based on the household income, Cascade Care Savings, which is our focus today, provides additional financial assistance to lower the premium cost of Cascade Care Gold or Silver plans. This extra premium help is added to any available consumer federal tax credit to lower monthly premiums. Next slide. So as a reminder, Cascade Care Savings is Washington State's monthly premium assistance program as directed by the legislature. The program launched in 2023, and we are here discussing the methodology that will be used to determine the Cascade Care Savings amount for plan year 2024. The draft Cascade Care Savings amount methodology is an annual model developed by the exchange's actuarial consultant Weekly. Cascade Care Savings provides additional financial assistance to lower the premium costs of Cascade Care Gold or Silver plans for customers under 250% of the federal poverty level and who meet all other eligibility requirements. In 2024, customers newly eligible for QHPs will be able to access state premium assistance if they meet other eligibility requirements. Next slide. So as the exchange developed, launched, and continues to implement Cascade Care Savings, we have the goals you see here in mind. Lower Washington's uninsured rate, advance health equity, as we know BIPOC communities in Washington state disproportionately experience having lower income and being uninsured. Cascade Care Savings helps reduce barriers to affordable health insurance to reduce inequity, and Cascade Care Savings is reaching diverse populations across Washington. Those benefiting from Cascade Care Savings are more likely to be younger, under 35, and non-white. Our goals also include supporting continuity of coverage and retention and provide a bridge for individuals in Washington state who transition between Medicaid and QHP eligibility. As an example, Cascade Care Savings is helping people who lost Apple Health afford QHP coverage. 57% are benefiting from Cascade Care Savings. In several rural counties, up to 70 to 83% are benefiting. And in 6 in 10 are receiving Cascade Care Savings, paying $25 a month or less for their premiums. Our other goals include maximize impact of state investment to affordable individual market coverage, positively impact the individual market risk pool, grow enrollment. Our record percentage of exchange customers are now seeing premium subsidies in 2023 thanks to continued enhanced federal subsidies and state subsidies introduced in 2023. Next slide. Cascade Care Savings maximizes all available federal tax credits and also helps customers who do not qualify for federal subsidies. The exact amount of savings received is based on where the customer lives, their age, and their income. On this slide, you will see an illustrative example of a 40-year-old customer in King County that is under 250% of the federal poverty level. Their premium with their current carrier is $433. We see they have APTC and are eligible for Cascade Care Savings. If they enroll in the lowest cost Cascade Care Silver plan in their county, they will have a $0 net premium after their APTC and CCS is applied. This customer can enroll in the lowest cost Cascade Care Silver plan or take their eligible CCS amount and shop or apply their premium assistance to their current CCS eligible plan. Shopping and switching to a lower cost Cascade Care plan allows customers to receive the same level of coverage for a reduced premium. Through Cascade Care Savings, 2023 was the first time the exchange could offer customers $0 premiums. Next slide. Thanks to Cascade Care Savings in plan year 2023, the average subsidy for a customer with APTC and CCS was $32, and their average net premium is $88. Over 55,000 customers are receiving Cascade Care Savings and have a lower monthly premium. A notable change I'd like to call your attention to, and an area of focus for your public comments, is that the plan year 2024 Cascade Care Savings model includes two fixed dollar maximum per enrollee Cascade Care Savings amounts, one amount for customers eligible for APTC and one amount for HBE customers who are not eligible for APTC. This year, all eligible customers had one maximum amount available to them of $155. This maximum amount is rarely fully reached for customers who are also eligible for federal tax credits. The average amount for customers who aren't eligible for federal subsidies, however, is the $155 maximum. Another area I'd like to call your attention to when you're thinking about your public comments are the model assumptions. We'd really appreciate your feedback and comments there as well. Next slide. So as a quick reminder, as we transition to the details of the draft 2024 methodology, if you would like to provide comments today, we'd like you to hold your questions until the end and raise your hand or put your questions into the chat. I'll ask you to introduce yourself with your name and affiliation. If you would like to wait and provide written comments, please do so by August 18th at 5 p.m. and send your comments to the Cascade Care email on this slide. I'll now hand it over to Ksenia Whitall, a member of our actuary team, Wakely, to dive deep into this methodology. Thank you.
Thank you, Julia. Can you hear me okay? Excellent.
Yes.
Okay, if we could move to our first slide, please. Excellent, and maybe the next one. Great. So as Julia mentioned, we'll go through in a little bit more detail and dive into the methodology we use to update the Cascade Care Savings maximum PMPM amount for the plan year 2024, where it was set in 2023, the changes in some of the program parameters and assumptions as we move into plan year 2024. And we'll discuss at the end the two options that are currently on the table and have been proposed and are open for your comment, and then the impact on the overall affordability of individuals in various cohort groups and various eligibility groups, and how the proposed Cascade Care subsidy amounts affect their net premiums. Next slide, please. Great. I think Julia did a great job covering the background and the parameters around the Cascade Care Savings Program, so I'll cover this pretty high level. So the Cascade Care Savings Program is, of course, a state premium assistance program. It is funded by about $55 million in the state appropriation. Of the total $55 million, there are a few amounts that are earmarked specifically for a particular cohort of the eligible individuals. So specifically, $5 million of the $55 million is allocated particularly to the unsubsidized, to the federally unsubsidized cohort of eligible members, to which we'll refer to as Group 2 and 3, and I'll define the groups here shortly. Additionally, $5 million of the total amount is also set aside as a reserve for a contingency in the case of higher than anticipated enrollment on the exchange, and individuals are eligible for the Cascade Care Subsidy Program. In our analysis, we solved for two different Cascade Care savings maximum PMPM amounts. The first amount is set for the federally subsidized cohort of eligible individuals. And generally, especially going into 2024, that amount could be set slightly lower than the amount set for the unsubsidized eligible individuals due to the presence of the federal subsidies that reduce the net premiums for that particular cohort of individuals. And then the second amount, as I just mentioned, is slightly higher amount generally, such that we achieve a lower net premium for the individuals eligible for Cascade Care subsidies, but not eligible for the federal advanced premium tax credits. We talked a little bit about eligibility already, but again, just to recap really quickly, eligible individuals are those with incomes of up to 250% of FPL in their household. The Cascade Care subsidies are only available for members enrolling in the Cascade Care Silver or Gold plans on the exchange, one exception being the American Indians and Alaska Natives eligible members who can enroll in any metal plan level to receive the Cascade Care subsidies. And then finally, as the illustration in the earlier slide indicated, the subsidy amount is capped essentially at the subsidy that would be available had the individual enrolled in the lowest cost Silver Cascade Care plan in the county that they reside in. Next slide, please. Okay, so just to level set of where the subsidies are set in the plan year 2023 that we're currently in the analysis that we performed last year, the amount of subsidy was set at $155 maximum per member per month. That amount was a single amount that applied to both members who are federally subsidized and those who are not federally subsidized. In 2024, after the approval of 1332 Washington State waiver, there is a new cohort of individuals eligible for Cascade Care subsidies that will be enrolling on the exchange. So those are the undocumented residents in the state of Washington with the same income and plan selection criteria that I just covered in the previous slide. So as a result, in plan year 2024, there will be three distinct groups of eligible members receiving Cascade Care savings. So group one, as we will refer to this in the subsequent slides, are just referring to individuals who are receiving both federal APTC subsidies and also Cascade Care subsidies. Group two are the individuals who are QHP eligible residents, but who are not eligible for the federal subsidies. And then the group three is really the waiver population are those undocumented residents who are again not receiving the federal subsidies, but will be eligible for Cascade Care subsidies. And we tend to combine the group 2 and 3 members, given that their net premiums tend to be higher due to the lack of the federal subsidies. Next slide, please. Okay, so this slide summarizes a few key considerations that go into projecting 2024 on-exchange enrollment specific to the 3 groups that we discussed, with the goal of course, maximizing the available funding for the Cascade Care Savings Program. So I'll walk through this pretty quickly, and certainly let us know if questions come up after the presentation. So we relied on the March 2023 enrollment snapshot provided by Washington Health Benefit Exchange. We use that member level detail data. We condense it to kind of a key cohort level and use the cohort level information to project it into 2024. In estimating and solving for the maximum Cascade Care savings amounts, we consider a number of assumptions, but adjusting for rate of effectuation through the end of the year. We consider how member attrition has been in place historically and account for that in our projection in 2024. We'll look at member persistency throughout the year, as not every member that enrolled and present in the snapshot will persist through the year. We consider the impact of Medicaid redetermination taking place currently and, of course, spilling into plan year 2024. We look at the number of individuals enrolling throughout the year due to the special enrollment periods and the overall uptake by uninsured members as the new plan year plans are offered during the open enrollment period. We'll look at off-exchange member migration due to the presence of the Cascade Care savings and therefore incentive to enroll on exchange for those who would be eligible for Cascade Care savings benefits. We further model plan switching from non-Cascade Care plans into the Cascade Care plans that offer the Cascade Care savings. And then we also considered some of the new programs in the state related to Washington Ample Health expansion and the potential DACA impact on 2024 enrollment. Finally, we've incorporated their preliminary 2024 plan rates that were filed by issuers. These are not yet finalized and will be finalized here in the next month. But you can see that generally the rate increases for non-Cascade Care plans on average were about 9.1%, certainly varied by area and by issuer and by plan. But for Cascade Care plans, those were slightly lower, but again, 8.5% relative to 2023 rate. Next slide, please. Great. So the chart on this slide summarizes the 2023 Cascade Care savings amounts for Group 1 and Group 2 and 3 combined there, as you can see at $155. Summarizes the existing enrollment and also kind of the average enrollment that we project for 2023 through the year end by a group split as well. And then the bottom sections here estimate the overall cost in millions associated with the Cascade Care Savings Premium Assistance Program, again, split by the group type, and then also on a per member per month basis. So with the denominator being just those individuals receiving the Cascade Care savings amounts. The middle and the rightmost sections here provide the same information for the proposed 2024 Cascade Care savings amounts. And we proposed two options, as I mentioned earlier. So option one amounts are proposed at 155 PMPM for the Group 1 cohort, and then at $200 PMPM for the Group 2 and 3. Again, the differentiation in those amounts is set to assist with the affordability for the Group 2 and 3 individuals, since those are not eligible for the federal premium subsidies. $155 amount for Group 1 was selected to be the same as it currently set for 2023. You can see that with those amounts and the additional waiver population enrolling in 2024, we can certainly maximize the $55 million funding, particularly if the program experiences higher than expected enrollment levels, which you can see in the high column there in the third column of the middle section. We also, in our estimates, we produce a range of estimates. So we have our kind of the best estimate, and then a lower and higher end of the range in terms of enrollment and therefore the associated cost of the program. So you can see that on the lower end of the range for option 1, we expect about almost just under $36 million cost of the program, and then on the higher end, we generally model the amount not to exceed the $55 million of available funding. Option 2 reduces the maximum Cascade Care subsidy amount for Group 1, and due to slightly more funding available as a result of that reduction, we're able to increase the Cascade Care subsidy PMPM for the Group 2 and 3 to $215. The thought process behind this option is if we look at the bottom section where we present the utilized Cascade Care savings amount PMPM, you can see that for Group 1 eligible cohort, the utilized amount out of 155 maximum amount, right, is actually quite low. It's averaging to about $36.71 there in option 1 and $34.40 under option 2. Of course, the reason being that those utilized amounts are quite a bit below the maximums is due to the presence of the federal APTC subsidies. Group 2 and 3 individuals are utilizing essentially their entire Cascade Care savings amount because to reduce their gross premium further. And so the one of the advantages of option 2 is the additional incentive for Group 2 and 3 cohorts to enroll from the higher CCS subsidy amount. So if you look at the expected enrollment under option 2 for Group 2 and 3, it's about 500 members more than under option 1. Next slide, please. The next item we wanted to address and just make sure everyone is aware of is the interaction between the second lowest cost silver benchmark plans, which is a silver plan, which is the second highest cost among all of the plans offered in a particular county. And that benchmark plan is used in calculating the federal advanced premium tax credit. The higher generally, right, so the higher the second lowest cost silver plan, the higher the federal subsidies, which translates into generally slightly lower Cascade Care savings utilized subsidies, which need to, infill that gap between the APTC amount and the actual premium that individual is purchasing. Since the Cascade Care subsidies are capped at the lowest cost silver Cascade Care plan, which is its own benchmark plan in each county where it's offered, there is kind of an offsetting and interaction effect between those two benchmark plans. So in general, the higher that lowest cost silver Cascade Care benchmark plan, if you can imagine, the higher the Cascade Care subsidy, right? So because it's a cap, and the higher that cap amount, the higher the utilized subsidy amount. If we actually go back slightly to the previous slide, the item I want to highlight is the increase in those lowest cost silver Cascade Care rates in 2024 relative to 2023 is what's driving the higher Cascade Care utilization that we're projecting for 2024. And specifically, if we look at Group 1 Cascade Care utilization per member per month of $28.44 in 2023, given the increase in that lowest cost silver Cascade Care benchmark plan in 2024, that utilization goes up quite a bit to almost $37 PMPM. And again, it's the change in those lowest cost silver Cascade Care benchmark rates is what's driving that particular effect there. If we can skip to 2 slides now, just to quickly illustrate this this effect here. So suppose that we have the following second lowest cost silver of $241. We have the lowest cost Cascade Care silver plan of $230, and then the APTC amount of $191 in 2023. If those particular rates are trending at different rates, right, as 4% for the second lowest cost silver and 8% for the lowest cost Cascade Care silver, you can see that the gap now between the second lowest and the lowest cost Cascade silver is essentially, $3 PMPM, right? It really narrowed that gap. And so as a result, the Cascade Care savings is picking up that difference and increasing from about $39 PMPM in 2023 to $50 in 2024, which is, relatively speaking, is almost, 27% increase. If we go to the next slide, and we can look at a different scenario where both of the benchmark plan rates are increasing at the same 6% rate. And there's the result of that, there's actually a very flat effect on the utilized Cascade Care savings PMPM going from $39 to $40. And so again, we have greater separation between the federal benchmark and the state benchmark. And so that's what's driving some of those effects that we see from year to year. So just to illustrate the considerations and the complexity and also the sensitivity of these various benchmark rates on setting the Cascade Care savings amount from year to year and by county as well. And next slide, please. So the final piece of analysis we wanted to share with you is around considerations that went into selecting the Group 1 cohort Cascade Care maximum PMPM amount. So as I mentioned, in 2023, it's set at $155, but really a low portion, right, almost $36 only of that on average is utilized by the Group 1 individuals. So what we wanted to understand is the impact on if we were to reduce that $155 amount to, let's say, $80 or some amount in between, what would be the impact on how many Group 1 eligible individuals would have access to zero net premium? And with the caveat that in order to have a $0 net premium, those individuals would actually have to select and enroll in the lowest cost Cascade Care Silver plan. So using the data that we had for this analysis, we looked at the distribution of members and the plans that are available to them. And you can see what we summarized here is percentage of members that would still have access to the $0 net premium at the various maximum Cascade Care savings amounts. And then also the last column there is just expanding that a little bit more and showing how many, the portion of group 1 that would have an access to Cascade Care plan of under $10 net premium. So the helpful kind of the inflection point, right, that we see in this analysis is that once the maximum Cascade Care savings PMPM dips between below $100, that's where we start to see more and more members having non-zero net premiums, right, even when they purchase that lowest cost silver Cascade Care plan. And so I think this was helpful information to guide the decision making in setting that group 1 PMPM amount in conjunction, of course, with the group 2 and 3 PMPM amounts and maximizing enrollment in those unsubsidized cohorts. I think we can skip the next slide because it essentially just shows the same information but graphically. So thinking about the conclusions and the input that we're looking for is, first of all, the 2024 subsidy amounts will still be updated with the final 24 plan rates when they are finalized in September. Will reflect the actual information on how Medicaid redetermination is affecting the 2023 on exchange enrollment, and therefore the remaining expected spillover effect into plan year 2024. And then a few considerations around the option 1 and versus option 2 Cascade Care maximum PMPM amounts by group. Both were developed, as I mentioned, with a number of policy goals, right? And some of the policy goals do have trade-offs. So we looked at, having the continuity with the prior PMPM amounts, particularly for group 1 individuals, aligning closer to the portion of the maximum subsidy amount that's actually being utilized by group 1 versus group 2 and 3 individuals. And then with that equity focus in mind, to the extent possible, to ensure that both cohorts of individuals, so those that are subsidized and unsubsidized, have access to affordable net premiums once the Cascade Care subsidies are applied. Option 1, as I'm sure it's obvious, results in kind of that flat continuity in the Cascade Care subsidy amount for group 1. Option 2 more closely aligns with, giving the subsidy amounts that actually going to be utilized, right? And does result in slightly higher percentage of individuals maybe not having access to the 0% net premium, recognizing that it's a really small portion of group 1 individuals. And then option 2, produces a higher incentive for those individuals to enroll on exchange and therefore have access to more affordable coverage. Slide, please. Okay, yeah, and I think that concludes our portion of the methodology section. So I'll pass it back to Julia.
Thanks, Ksenia. I'd like to now open it up to any public comments. And if you have any, would you please raise your hand and then introduce yourself with your name and affiliation. I'll give it a few seconds. Yes, I see a hand. Please go ahead.
Hi, Julia. Thanks, Laura Kate. Thank you so much for providing this opportunity to comment. I actually have some questions. I was curious, what percentage of the available premium subsidies amount has not been allotted in 2023, or rather, what is projected to be unspent?
And this is in out of the total 55 million funded spending amount. Is that what you're referring to?
Yes.
Or yes. Yeah, I think if we go back to the slide with the tables, the overall spending in 2023 is quite a bit below the overall allocated funding amount. Yeah, if we can jump to that slide.
I can jump in.
Okay,
also,
great.
Ksenia, if it's helpful, maybe you and I can talk about this together. So, Lychee, the projected spend that's in the model that uses March enrollment and effectuation data is $20 million for plan year 2023. With more updated information, which in Wakely will be taking into account, the exchange is projecting to spend between $22 and $24 million in plan year 2023 on Cascade Care Savings. And when we think about sort of how the legislature appropriates this by fiscal year versus plan year, in fiscal year 2023, about half of that amount of that $55 million was spent. It cuts basically through the middle of the plan year. So it was $11.5 million was spent in fiscal year 2023, which ended in at the end of June.
Does that answer your question, or do you have any follow-up questions?
Yeah, so just to make sure I'm understanding, so 11.5 million was spent of the available 25 million, so less than half?
So the legislature, the fiscal staff, and our financial team worked together after open enrollment to understand what the projected utilization was going to be in 2023. And so there's alignment with the 11.5 million in fiscal year 23 and what the legislature appropriated. When we look forward, the legislature appropriated the full $110 million for the 23 to 2025 biennium. And that's, what we requested as far as when we apply that to plan years, $55 million for fiscal years 24 and 25. And that'll support the remainder of plan year 23, plan year 2024, which is the topic of today, and the first 6 months of plan year 2025.
I understand, I think, the complexity of the different fiscal years, and appreciate you doing that walkthrough, but just to confirm my understanding, there was approximately 25 million available for the first half of 2023, and 11.5 million was spent. Is that correct?
That's correct.
Okay, and so I see Joseph has his hand up, but one question I want to raise is, given that experience, does it make sense to hold 10% in reserve? My understanding is HBE can hold up to 10% in reserve, but given how significantly Cascade Care Savings was underspent, it seems like a lower reserve amount may make more sense, given that this is the first year of the 1332 waiver and those folks will not be eligible for APTCs.
Yeah, that's a great comment, Lychee. We appreciate that. I don't know, Ksenia, if you have anything to add before we move on to Joseph's comment.
Yeah, I think it certainly makes sense. And the uncertainty in the take-up and the enrollment, again, the 2023 was really the first year of actual experience that we could use to both fine-tune the projections and understand kind of the willingness to purchase, right, by the individuals in the market. With that experience, we've done a lot more refinement. And again, we project a pretty wide range, as you saw in those slides, still given the uncertainty. But it's a good question, and again, I think the reserve amount is the 5 million, right? It's not the full. I guess maybe 10. You mean for the 2-year combined? I understand.
Thanks, Lychee. I see another hand, Joseph.
Hi, this is Joseph Shoji Lockman. With Asian Counseling and Referral Service. I'm their policy manager and also here as part of the Health Equity for Immigrants campaign, and very much appreciate the questions that Lychee asked. As a wonderful colleague in this work. I did want to emphasize, I think that, based on a lot of our discussions with other stakeholders in this process, the feeling is it seems that there's a strong preference for the second option, knowing things aren't necessarily ideal, but if there is going to be projected underutilization of state subsidies for folks who are eligible for federal, then we think that really aligns with the equity values that are central to our efforts to ensure that folks have access to healthcare. Noting also that I also strongly agree with Lychee's point with regard to the amounts held in reserve for 2024 based on the 2023 enrollment and Cascade Year savings, lower than projections. Would really love to hear from HB, what kind of possibilities there really are for making sure that we're not holding on to too much in reserve, and actually the possibility of opting for a lower reserve percentage. And also want to just emphasize the need for really advocating for more equity in the PMPM subsidy approach. Again, I think Lychee has also done some really important work in helping a lot of stakeholders come into alignment on this, and that's noting that there's concerns about a flat dollar, the flat fixed dollar approach for premium assistance, which is really not helping a lot of folks who are, I think, struggling the most, especially for folks who are not eligible for federal tax credits. For undocumented community members, I will also note that a lot of times I think there's a tendency to overlook the fact that there's a large amount of undocumented Asian Americans and Native Hawaiian and Pacific Islander folks, in addition to other communities who we're trying to raise up in this conversation. And a lot of the community members who we've spoken with feel like the cost sharing is going to be really the main barrier to them feeling comfortable accessing these programs. So really hoping that there are other ways also that the exchange can look into implementing cost sharing assistance, again, so that our folks will be able to feel comfortable applying for applying for health insurance. Again, though, just noting, it a lot of times, like, even just the terminology for a lot of our community members with limited English when it comes to deductibles, co-pays, co-insurance, etc., even for native English speakers in our communities are already overwhelming. And exploring more cost sharing assistance options, I think, will be vital to boosting the enrollment numbers there. I think that's those are some of the main points I wanted to emphasize. It again, just again, I'm really in solidarity here with Lychee and other members of our Health Equity for Immigrants campaign who've, we really are trying to uplift the concerns that community members have brought to us.
Excellent points. Thank you. And those are all noted. Lychee, I see your hand again.
Thanks, Julia. And again, this is once again more of a question rather than a comment. And I did note I forgot to introduce myself when I first spoke. My name is Lychee Leong. Lychee is my first name. I am the Senior Policy Advocate for Northwest Health Law Advocates. I'm curious whether the exchange has looked into a less regressive distribution of premiums within groups, and also what discussion there has been around cost sharing, and what potential timelines there are for those strategies to address equity. I know that cost sharing is authorized but hasn't been funded by the legislature. But if funding were possible, I'd be curious about the timeline to implementation, and also curious, given the experience of COFA Islanders and cost sharing prior to their inclusion in Medicaid, whether a solution like that could be implemented, at least for the legally present population that's not anticipated to be eligible for the Medicaid-like program anticipated to start in July of next year.
There are a lot of components to that. I think Lychee, to get to the some of the policy considerations that the exchange has considered. I know that there were a range of options considered when the legislature first authorized and we began implementation of the state premium assistance, including, some consideration of how cost sharing reductions could be a good complement to a state subsidy as well. So I know that the exchange has considered some of the elements that you've discussed. That's not something that I think we've revisited this year, and I think your comment is well taken on how we can look at these various approaches year over year, as far as policy changes and also modeling cost sharing reductions. As you noted, it would require additional state funding in order to fund that. I can't speak to an implementation timeline at this point, but happy to engage with partners in that conversation if that was something possible to proceed with. And I feel like you had a third question that I have not addressed.
Oh, just mentioning the experience of COFA Islanders and the cost sharing assistance that was provided them when they were ineligible for Medicaid, and given the fact that the legally present non-qualified population will not be eligible for the Medicaid-like program anticipated to start in July of next year, whether there's been any discussion of cost sharing, at least for that population, in light of those parity and equity considerations.
I believe there have been conversations about that, Lychee, but I would need to take it back and circle back around on where those conversations are at this point. And this is really helpful feedback for us as well as we think about the subsidy program and Cascade Care holistically. So I appreciate the questions, and I appreciate sort of the prompts here around what else to consider.
Thanks, Leachy. Thanks, Joseph. I'll give it a few more seconds for any additional public comments. Okay, I think we can move on to our next slide. So thank you so much. We really appreciate your excellent comments and your questions. I will please invite you to provide any written comment on the draft Plan Year 2024 Cascade Care Savings Amount Methodology by August 18th. Again, please provide it to the email on this slide. If you think of any additional questions or comments after this meeting and you'd like to meet one-on-one, we would love to do that with you and discuss. And as I mentioned earlier, the final methodology will be informed by your comments, final rates, updated enrollment, and the final methodology will be sent out and posted once Plan Year 2024 rates are final and certified by the Exchange Board. Thank you so much. I really appreciate it.